Welcome back. I'm Jim LaPierre. This is Sober Now, and today's topic is misdiagnoses. And do you have a mental health diagnosis that actually is not appropriate for you? As always, very much welcome your questions, your comments. Want to hear from you, whether it's on topic or not. Just message me on any of the streams that we have going today. If you haven't already been over there, please take just a minute and head over to our Facebook page for Sober Now. Give it a quick like and you'll get notifications about future live streams and all the content that we're creating. So we're going to jump into it. What I'm talking about primarily today is why is it that we get misdiagnosed? There's lots of reasons for that, but before I get into it, I want to just touch on this real briefly. We, as people in recovery, we have a tendency to pathologize ourselves, and unfortunately, we oftentimes diagnose ourselves with conditions that we don't have. This has become part of our social vernacular. We refer to people as being bipolar because they're very moody, or we say that we have ADD because we're really disorganized or have trouble focusing our attention. This is just one more subtle way in which we shame ourselves, and so I want to ask you to consider that. So, lots and lots of reasons why this happens. Misdiagnosis occurs in active addiction. It occurs in early recovery or even in late recovery. And for a lot of us, we were misdiagnosed as children. And we'll talk about some of the reasons why that happens, why it plays out. To my way of thinking, the most important form of misdiagnosis is when we hide or don't reveal having a substance use disorder and we get diagnosed as having a mental health condition because the person who's diagnosing us doesn't know to ask, doesn't ask the right questions, or because we don't feel comfortable in answering honestly. All of those create huge possibilities to be misdiagnosed. When I explain mental health conditions to people, one of the things that I point out early on is that there's a huge overlap in symptoms between different conditions. So for example, if I cough and I sneeze, do I have a cold? Do I have the flu? Do I have bronchitis? Do I have an upper respiratory infection? Do I have pneumonia? We don't know because those are symptoms of all of those. So this is one more reason why diagnosing yourself is probably a bad idea. But it's also a reason why, unless a person is really well trained in mental health, they're going to misattribute symptoms to a condition that we may or may not have. And as shocking as it might seem, a lot of the folks who diagnose, particularly medical doctors and physician assistants, actually have very minimal training in mental health. So, unfortunately, active substance use disorder looks a lot like several different mental health conditions. Typically, if, for example, somebody's abusing alcohol and cocaine, well, that looks a lot like bipolar disorder, but it's not. It's explained by their use of substances. If someone's abusing stimulants, they may, at face value, seem to have attention deficit disorder. But again, this is not an organic illness. This is a product of substances that we're using. Alcoholism, it looks a lot like depression, and for a lot of us, it's masking anxiety. But if we're not revealing our use of substances, and sometimes we wait to be asked, sometimes we minimize the significance of our use, we usually understate how much we're using, how often we're using, and I mean that we do that out of shame, we do that out of guilt, we do it for a lot of different reasons. I get it, but I always say to folks, don't lie to the person who's diagnosing you. Don't lie to your doctor. They can't treat what they don't know is happening. I understand privacy. I understand how hard it can be sometimes, particularly if we're mandated into treatment. But it's not a black and white piece. So, for example, you don't have to tell them absolutely everything, and you don't have to lie. You can always say, I'm not comfortable answering that question, or I prefer not to talk about it. Because one of the hardest pieces about getting a diagnosis is that it comes from an assessment. The assessment is usually done in the first appointment. And so this professional that you've known for all of 5 minutes is asking incredibly personal questions about trauma, about past abuse, about our childhoods, about our most intimate relationships, and a lot of things that many of us find really difficult to talk about. It's very common that we get misdiagnosed in early recovery. Maybe we are seeking treatment or reaching out for help to get sober, stay sober, find a pathway to recovery, whether that's medicated assisted treatment or harm reduction. The problem there is that early recovery also looks a lot like mental illness. It muddies the waters. If you find yourself highly anxious, super depressed, scared shitless because you're looking at the wreckage of your life, that doesn't mean you're mentally ill. It means you have some clarity about the devastation that substance use disorder created in your life. And too often we're in a hurry to get diagnosed because we've always been told there's something wrong with us. We've always believed there must be something wrong with us. But that doesn't mean that it's necessarily a mental illness or a mental health condition. Psych meds are all the more tempting because wouldn't it be great if there was a pill that fixed everything? Wouldn't it be great if there was a pill and I just felt good forever? I think that's a big part of how a lot of us get started on the road to addiction. Some of us were misdiagnosed as children, and in particular, we're diagnosed with organic conditions that we didn't have. I should explain, an organic illness is something that you're born with. It's coded in your DNA, and it's only a matter of time until you start manifesting symptoms. Usually, with some conditions like attention deficit disorder, they'll be evident in early childhood. Other conditions like bipolar disorder tend not to surface until after puberty, anywhere between 13 and 21. Other conditions like schizophrenia or schizoaffective disorder, typically we don't see onset until late adolescence or even early 20s. So there's a lot of problems when we organic illnesses are, no question, overdiagnosed. And there's some important reasons for that. The first is that if a child has an organic illness, then by definition, that is not a failure of parenting or a product of abuse. We can simply say that they were born with it, and all they need is the right medication or the right form of treatment. It absolves parents of the idea of any wrongdoing. Medically trained professionals are biased and tend to overdose organic conditions because it's completely consistent with their training. Medical training works from the medical model. The medical model says that the person who's treating you is an expert, you are a passive recipient, and the medical model works really, really well if you have something like a broken leg. You could see 10 different doctors, they're all going to come to the same diagnosis, they're going to prescribe the same treatment, the same prognosis, the same everything. Mental health, by contrast, is very subjective. There's a huge overlap of symptoms, and potentially you could see 10 different therapists, get 10 different diagnoses, 10 different forms of treatment, and 10 different prognoses. So we need to go slow, we need to do our homework, we need to be honest with the person who's diagnosing us, and if we're seeking medication management in particular, there's a few things that we need to be concerned about. Again, MDs and physician assistants, very, very minimal mental health training. There's 10 million things they need to learn about, right? And unfortunately, substance use disorder and mental health are two that they receive very little training on. It's very rare nowadays that a person sees a psychiatrist. More and more, the medical model is we see a psychiatric nurse practitioner or a family nurse practitioner who is supervised by a psychiatrist. And those folks actually have pretty fantastic training, particularly psychiatric nurse practitioners. Their training and education extends well beyond what a physician's assistant does, and they have an enormous amount of training in mental health. Psych meds contain some concerns for those of us who have substance use disorders, particularly if the medication that we're prescribed is addictive. So stimulant medication for ADD and benzodiazepines prescribed for severe anxiety panic disorders, those types of conditions are easily abused, easy to develop dependence on, and they have always the possibility of drug interaction. Particularly the mix of benzodiazepines and alcohol is insidiously dangerous. So these are some things that we need to be aware of. Ideally, we're going to be honest with the person who's assessing us and treating us, especially if they're going to give us medications, because that's one of the places where diagnosis is really, really important, because assessment drives diagnosis, which drives the decision of what medications to prescribe. So letting your medication manager know that you are in recovery from substance use disorder will help ensure that they don't provide you a medication or a drug that is potentially addictive or easily abused. I think it may be really uncomfortable to disclose that, particularly in the first meeting, but anything else is a risk that most of us simply cannot afford to take. So let's just review this real quick. The assessment is usually a series of questions that a person is asked holistically about their lives, their past, their present, what they hope their future is. In mental health, we refer to it as a biopsychosocial spiritual. What that means is we're looking at the person from a biological point of view, from a mental health or psychiatric point of view, a social point of view in terms of their relationships and those types of things, and then also ideally incorporating some sense of their faith or their spirituality into treatment. Getting an accurate diagnosis hinges 100% on accurate and honest self-reporting. It's so uncomfortable to have these conversations right up front. But again, don't lie to your doctor, don't lie to your therapist. If you don't want to answer something, don't. If you're not ready to talk about something, that's totally okay. But to deny, like for example, if you're asked, did you experience any form of abuse or neglect as a child? It's a very different thing to say, I'm not ready to talk about that, than it is to just deny it and say no. Unfortunately, almost the overwhelming majority of us who live with substance use disorder have experienced some form of trauma, and the overwhelming majority of us have also experienced childhood abuse. And even if we didn't have a trauma history prior to developing an addiction, the places that addiction takes us almost always involve some form of experiencing trauma. And this is one of the most difficult things in early recovery. The adage is the good thing about being sober is you feel more, and the bad thing about being sober is you feel more. What doesn't get talked about enough is the longer you stay sober, chances are the more likely you are to remember pieces of your past, the more likely you are to have intrusive thoughts and things surfacing that you're not really ready to deal with. And of course, the emotions are overwhelming to us for a lot of different reasons. It feels like there's too many of them. It feels like they're too intense. And oftentimes we struggle to even identify what they are because we spent so many years medicating them, denying them, running away from them. So I think the point that I want to stress the most is it's almost impossible to accurately diagnose someone until they have 6 months of either 6 months of some form of recovery, minimally MAT, ideally abstinence, because what we're really trying to do as professionals who assess is get a sense of what a person's baseline is. The baseline is, how are you doing most of the time? So you have good days and bad days, right? It fluctuates. But overall, what is it that you're living with? How is it that different conditions are affecting your life in the present? And what is it that we need to do about that? Early recovery, active addiction, and childhood trauma all mimic mental illness, but it doesn't mean that we necessarily have those conditions. Trauma throws a wrench in everything, including getting a clear-cut diagnosis. It's actually very common for a high percentage of us, that our biggest challenge, our biggest problem, the thing that most undermines our mental health and well-being is that we've survived trauma. But it's also common that a lot of us don't meet full criteria for a diagnosis of PTSD. Intrusive thoughts, hypervigilance, flashbacks, nightmares, night terrors, these are some of the most common symptoms of PTSD. And whether we get diagnosed or not, typically the real challenge is I've survived a lot of really heinous things. My past isn't really over because it keeps resurfacing. I feel like I keep reliving it. And I think my experience is the most important aspect of getting an accurate diagnosis is looking for medical conditions, which include substance use disorder, and weighing the impact of past trauma. When I say that we need 6 months to get an accurate diagnosis, what I'm including in that is that we have to have basic life need fulfillment. So if we're trying to assess someone who is currently homeless, who has food insecurity, who has medical conditions that haven't been taken care of, any very basic life needs that aren't being met undermine our stability, the degree to which our lives are manageable and sustainable, and again, they will mimic the symptoms of a lot of different forms of mental illness. I always encourage folks, follow Maslow's hierarchy. Start with the very basic things. The more that we get those needs met, the more that we have stability and we can determine what is an accurate baseline for you. The more we can weigh things like who are the toxic people in your life, who are the supportive people in your life, what are the things that you need objectively and how can those be met, what are the things that you need emotionally and how are those getting met, what are you using to cope, what are you using to prevent relapse, what are you using for fellowship and support. For so many of us, we're fighting this battle alone. We don't have healthy friends, we don't have supportive families, and we're white-knuckling our way through an awful lot. I'm going to pause and check the streams real quick, but again, always want to hear from you, always want to hear what's going on with your recovery. Okay. Another piece of advice, stay away from WebMD, stay away from sites that are designed to help diagnose a condition. They will most often either be difficult to understand because of professional jargon, or they will lead to considering that you might have a condition that is far more severe than what you're living with. There's a running joke of sorts amongst people in recovery that if I'm feeling ill, it's probably a brain tumor. We have a tendency to jump towards the worst possible outcomes, predict that whatever the worst scenario is, we're just going to start planning for it now. By contrast, if you're looking for a good resource that explains mental health conditions in layperson-friendly terms, in my experience, Wikipedia is actually quite good at that. It helps us understand what a diagnosis means, what the particular symptoms are, and what types of treatment are available for it. I'm always urging folks, when it comes to any form of treatment, whether it's for substance use disorder or mental health, or even for medical conditions outside of substance use disorder and mental health, don't be passive. Too many of us simply feel like we shouldn't bother the doctor with a whole bunch of questions, or we shouldn't challenge the authority figures who have given us particular diagnoses. Passive approaches don't work for us in anything, and especially they don't work in treatment. Some of the most common misdiagnosed conditions for people in recovery: bipolar disorder and borderline personality disorder are at the top of that list. Bipolar disorder is an organic illness. It involves experiencing depressive episodes and manic episodes. And there's an important piece that has to be considered here. For most of us, if we're in early recovery, or many of us are even years into recovery, we frequently experience times where we feel depressed and times where we feel anxious. Now, depression and anxiety looks a lot like depression and mania. And that's one of the biggest reasons why we get misdiagnosed with bipolar disorder. The most important piece to understand about mania is, well, in layperson terms, it's a lot like doing cocaine. People who are manic have an enormous amount of energy. They quite often can stay awake for 2 or 3 days at a time and not feel tired, but they come in two primary forms. The first one is paranoia. They feel like they need to withdraw and be locked away from people. And the second form is a manic presentation where the person is overly optimistic and they're going to take on the whole world and they're going to start a new company by Tuesday and it's going to be great. Anxiety, by contrast, is there's a lot of energy behind anxiety. It creates this nervous energy, this worry, this fidgetiness, this feeling that we don't quite know what to do with ourselves. But if you have been diagnosed with bipolar disorder, or you're considering whether or not you have it, the first piece that I would point you towards is sleep disturbances, and very specifically, have you gone days at a time without using substances and not felt tired? And if so, then maybe. Bipolar disorder is actually pretty rare in women. Over 80% of people who have bipolar disorder are cisgendered men. So looking at a diagnosis like a personality disorder, most commonly borderline personality disorder, a person who lives with that condition is somebody who only lives at the extremes, particularly in their relationships. They can love you this morning and hate you this afternoon, and it's not contrived, it's not a manipulation, it's a genuine emotional experience. Through the course of addiction, growing up in addicted families, all the places that we've been, we are people who tend to live at the extremes. It's all or nothing, it's black or white, it's now or never, it's good or it's bad. And only with long-term recovery can we get an accurate sense of, are you living this way because of substances? Are you living this way because this is what you were taught? A personality disorder says that a person's entire way of living is flawed. By contrast, a condition like bipolar disorder is something that we live with. It's a medical condition. It may affect us a great deal. It may not. It might be something that with medication is completely controlled. But a personality disorder says essentially the way that you're living is fundamentally fucked. And so this too is an important piece to distinguish. Is my life unmanageable because of where addiction took me? Is my life unmanageable because I struggle to feel safe? Safety and stability are two of the most basic of human needs, and they're not something that we talk enough about. Learning to feel safe inside your own head, inside your own body. These are vital pieces of mental health and well-being, but too often we take them for granted. Too often we go looking for a shortcut. Let me find a condition that maybe I have. Let me get some medication that will maybe take care of it. And then there's this expectation that everything will be better. Life doesn't work that way. Recovery doesn't work that way. Health doesn't work that way. ADD is something that we're commonly misdiagnosed with. We're scattered. We find it difficult to focus. We find it difficult to organize ourselves or to stay on task. The symptoms of ADD, every single symptom of attention deficit disorder is also a symptom of post-traumatic stress disorder. So again, it's the overlap of symptoms that we have to ferret out. A lot of us consider the possibility that maybe we're autistic or somewhere on the autism spectrum. And the thing that I point out quite often to folks is that survivors of trauma quite often present as folks with autism too. There's a lot of muddy waters here, and there's a lot of things that are hard to ferret out. So I think the points that I really want to drive home to you is, first of all, don't be passive in treatment. You have a right to privacy. You don't ever have to disclose something to a professional that you don't care to, but please don't lie, because that is going to make misdiagnosis all the more likely. Don't be passive in any form of treatment. Any form of therapy, any form of counseling, ideally will be a mutual process, not something that you just passively receive, but something that you work with the professional to help build a process that works for you, based on your goals, not somebody else's ideas of what your life should look like or what it is that you need. Looking for how do different parts of your recovery work together. So for example, therapy and counseling should be able to incorporate what you're doing in a 12-step community, or what you're doing in your faith community, or anything else that's helpful to you. And so looking at how we can get these different pieces of your recovery to work best together for you is something that is really important to bring to your counselor or your therapist as a need. Unfortunately, a fair percentage of even therapists fail to understand substance use disorder and what's effective in treating it. The good news that I always share with folks is everything that supports recovery from substance use disorder can also be helpful in recovery from trauma and any form of mental illness. So anything that helps you to have healthier perspective, healthier self-control, is not just useful in your recovery from addiction, but in your recovery from any other condition as well. Going to be wrapping up here in just a moment, but as always, I want to encourage you to connect with me. Jim@sobernow.com is the easiest way to do that. Love getting your emails, your questions, ideas that you're struggling with, or things that you need for your recovery. Would love to have you check out Sober Now's YouTube station. Well over 100 videos there, completely free. Just give that a quick like and you'll get notifications on live streams. And of course, we'd love to have you check out our site, sobernow.com. Eminently affordable home study program that ensures both confidentiality and anonymity. Go at your own pace with our home study programs. We have two. One for enhancing your recovery from substance use disorder, and the second one for affected others, for folks like myself who identify as having loved ones in active addiction or perhaps early recovery. Please take excellent care of yourselves. Please let us know how we can better serve you, and I will look forward to